Hi, I'm Dr. John Giannakis from Northwoods Urology, and today we're going to talk about low testosterone. Testosterone is a male hormone, although it's present in both men and women. And the levels are highest when you're in your 20s, and it progressively goes down. So every single decade, the level will be lower and lower. As the testosterone gets lower, and it can happen at any age, the symptoms that men will notice are low energy, low sex drive, problem sleeping, problem losing weight, mental focus decrease, and there are also other side effects which you don't see, like decrease in bone density. So low testosterone is a natural male hormone. It's an anabolic steroid which your body needs for muscle buildup and bone buildup, but it will go down as we age, but there are also certain pathologic conditions that have to be checked out, including pituitary tumors and other illnesses. Once you make the diagnosis of low testosterone, you have several options. Replacement options are natural, which can be done by exercising, weightlifting, resistance exercises, or you can actually replace it. The two ways of doing it is you can induce or make your body produce its own testosterone, and you can do that through a variety of means, or you can actually replace the testosterone in various ways, including patches, creams, ointments, shots, or pellets. Once you have the symptoms, the only way to find out if you have low testosterone is to actually get a blood test. Once we make the diagnosis of low testosterone, then we have to decide, or the patient has to decide whether they want to have it replaced or not. And that's strictly related to how the symptoms will affect them. Once you replace it, you can almost be certain that all of the symptoms that are related to it will actually progressively get better. So you will have more energy, better sex drive, the workouts at the gym will be a lot easier, you'll make gains a lot easier. Basically, you will feel more like a 20-year-old than the age that you're at right now. If you're a male and you have any of those symptoms and you want to feel better, you can contact our office and make an appointment with one of our board-certified providers here, get tested, and then see if replacement is appropriate for you.